Broward Community Health Hub collaboration. I wanted to, there we go. So this is a project, a collaboration that started around the end of last year. And we've been doing a lot of exploration and planning with different partners and trying to build outreach and engagement with additional people in the community, focusing on the area of South Broward. Our funder is the Community Foundation of Broward. We are the coordinating agency, and we have some expert support from FEED and the Dana Beach Patch. We hope to be working together for the rest of the year, and that's the plan. So we are here to learn a little bit more about what we've been setting up, but nothing is set in stone because we are going to be co-creating everything together. And that's why everybody's here today. Thank you all for joining us. And I'm going to get started by passing it on to our funders for a quick welcome. And again, thanks everybody that's joining us here today.
Thank you, Aurelie. And my name is Angelica Rosas. I am the Strategic Grants Manager at the Community Foundation of Broward. And I just wanted to say how thrilled I am that everybody is on this Zoom here today. This particular investment that we have made into urban health partnerships and to create the South Broward Community Health Hub is a new approach for the foundation. We're trying to deepen health outcomes of all of our South Broward residents, and in doing so, we want to make sure that we empower community voices. And that's why it's so important that you guys are here to help us build out this health hub, and especially during this coronavirus pandemic, when we have so many individuals who are struggling to find proper food and nutrition and to stay healthy. And so I'm going to keep it short and sweet. And I just wanted to really say thank you so much for being part of this collaboration. And I can't wait to see what is going to happen and how everything is going to create greater impact for our residents in South Broward. Thank you.
Thank you so much, Angelica. And we have other partners from our funding agency, the Community Foundation. So thank you all for joining us today. And now I'm going to pass it on to our Urban Health Partnership CEO and Executive Director, Andrea Iglesias, for another quick welcome and a little brief of an intro to what Urban Health Partnerships is all about. Andrea?
Thank you so much, Aurelie. Good morning, everyone. I'm so excited to see so many folks join this kickoff meeting. As Aurelie mentioned, I'm Andrea Iglesias. I'm the CEO and Executive Director for Urban Health Partnerships, or UHP, as you'll hear us refer to ourselves. UHP's work as the lead of Food for All Broward began around 3 years ago. And this South Broward Health Hub effort is, I think, a really great example of what we really hoped could grow out of this initiative. Something that's collaborative, action-oriented, community-driven, high impact, that can really address healthy food access in a way that centers equity. And again, that empowers community voice. So thank you, Community Foundation of Broward, for your support and your investment, and for everyone who's here, because it's an investment from you all as well, to really come together for this effort. I did want to take a moment to share briefly about UHP and who we are. UHP is a public health nonprofit. We've been around since 2011. This year is actually our 10-year anniversary. We serve Southeast Florida. Our mission is outlined here. I wanted to highlight just a few key words from our mission because I think they really speak to who we are. So there's invest in sustainable. What that means is that we don't just parachute in and leave when we're done. We're really committed to ongoing initiatives and investing in communities over time. We've been working in Broward for a long time with a lot of individual municipalities and communities as well. And we plan to continue to do so. It's part of our investment as an organization. The word co-design means a lot to us. That means that we prioritize the voice, the needs, and the leadership of the communities that we work with. And then, of course, equity and health equity are at the core of everything that we do, and are essentially our guiding principles. The graphic here highlights our 5 initiatives, and it gives an overview of how we put that mission into action. Health equity, as I mentioned, is at the center, and it really guides everything that we do. And we focus on promoting equity and addressing health disparities by looking at policy systems and environmental levels. So we do some programs, but we always do them in the service of this larger picture of creating change that's sustainable, where we're looking at health really comprehensively and we're addressing social determinants of health that we know that impact people across the lifespan. The lifespan. So while these are all really interrelated, we picked these because they really allow us to focus on key areas that we've identified as crucial in being able to actually mobilize toward our health equity goals. And as you can see around the circle, community-driven leadership is really what guides all of our efforts. And of course, today you can see one of our key initiatives is food access, security, and justice, which is what we'll be focusing on today. So just wanted to say that we're really excited again to have you all here and to launch and continue this co-design process that we really feel can become a catalyst for so many impactful outcomes in South Broward. So thank you so much for being here and really looking forward to the collaboration. Thank you.
Thank you so much, Andrea, and again, to our funders at the Community Foundation. And now let's move on to some of the housekeeping so that we can get started. And thank you all again, all of the beautiful partners and people that we've been working with and connecting with. This is something that we're going to be building together. From the beginning, we've already started building some of these things together. As one thing that we will touch back on in a little bit, but the Community Foundation of Broward has also invested in short-term pilot projects through this effort. So there's also additional partners that are receiving some initial funding to start building some ideas that could help us build this hub. And there will be other opportunities to do that later in the year. So I'm really excited to share more about that. But first, here's our agenda for today. We're moving on to partner introductions now, and we'll definitely get into the next pieces of introducing Broward Health Partnerships and the collaboration. Although Andrea already kind of gave us the overview, I'll talk more specifically about Food for All Broward and how we're going to be coordinating this effort. We're also going to give you some updates that have been happening since the start of the grant. And then we really want to spend a lot of time listening to you. We want to hear from you and learn a little bit more about how you see yourselves connected to this effort and some of the work that you're already doing and some of the successes that you're already having so that we can continue to build on those and work together to build a bigger, better effort together in South Broward. Our meeting objectives for today are to learn about Urban Health Partnerships as an organization and our role as coordinators of this collective effort, to introduce the South Broward Community Liaisons, that the Community Liaison Framework and the role that this plays within the South Broward Community Health Hub collaboration. We will establish a baseline understanding of our project, the partners, and the concepts that will be developed throughout. And we will start the co-design of the initial vision for this Community Health Hub and start thinking of this long-term effort and the planning of implementation of it. And we'll also be looking at some logo ideas so that we can together think of what is going to be the image that represents our efforts. All right. But first, let's start with our partner introductions. As you can see, we have 34 people on the call today. So we want to keep this brief because, as I mentioned, we will have more time to share later on during our partner shares. But right now, I will be sharing a link on the chat. There's going to be an opportunity for you to share more detail on who you are and what organization you represent and all of that in that South Broward Community Health Hub database. So I'll share the link in 1 second. But in the meantime, please, we want to just be brief. We're going to go around and just share your name, your affiliation, like if you're a community member, say you're a community member, if you're so if you work with an organization that you want to bring up, please let us know who you're working with. And in just a few words, no more than a sentence, what brought you here today? We're going to go around if maybe Beth or somebody from our UHP team can help me kind of popcorn this to let people know who can go next. That way we can kind of keep it short and brief. And in the meantime, I'll put the link on the chat so that everybody can join it and access it and add additional details about you and your organization on that database. All right. Okay, so well, I'll start with myself so I can give an example. My name is Lozano. I actually haven't introduced myself because I feel like I know everybody on this call, but I am the Health and Community Development Program Manager for Urban Health Partnerships. And I am here because I believe in the work that we do together. Oh. Who would like to go next? Beth, maybe you go next and then we can jump for next persons from there.
I am Bishop Scott with St. Ruth Missionary Baptist Church, and we are committed to creating sustainable efforts to partnership and impacting our community.
Hi, my name is Tim Curtin. I'm with Memorial Healthcare System, and thank you so much for inviting us. And certainly, we are in the South Broward Hospital District, and food is medicine, and we know enough about social determinants of health now to really understand the value of nutritious food now more than ever. Thank you.
I'm Albert Jones. Good morning to everyone. So joyful to see this coming into fold. I'm a congregational care pastor at St. Ruth Missionary Baptist Church. Have served on many levels, and certainly I'm glad to see that this is coming into fruition today. So just glad to be here, and hello to everyone. Hope that you're safe and your families are doing well.
Hi, good morning, everyone. My name is Christine Pastrana. I'm a volunteer in the administrative capacity so far for Be the Drop Foundation. And hi, that's all.
My name is Gloria Black, and I'm the outreach coordinator for the St. Ruth Missionary Baptist Church with helping the community with what they may need. Thank you.
Good morning. This is Zaina Zain, the founder of a mobile school pantry, and we're committed to creating a future without hunger, where every child has access to sufficient and nutritious food. And we believe that food is crucial for the well-being and success of all individuals and the foundation of a strong and vibrant society.
Hi, good morning.
Good morning.
My name is Catherine Periel. I'm actually a community member. And so what brought me here today is just my passion for social justice, advocacy, and also just creating a better future for the community.
Anybody else would like to say hello to everybody? Just giving some time for that introduction. And I also posted a link.
Good morning, can you hear me? Okay, awesome. Good morning, everyone. I'm Darlene Riggs. I'm here representing the Drop Foundation, and I just love to advocate for those who can't advocate for themselves. And I have a heart for the 303 zip code in the beautiful city of Miramar. So I'm looking forward to how we can all get together and better all of our communities. Thank you.
Good morning, everyone. My name is Lacey Boyles. I'm with the American Heart Association. I'm here today to help collaborate and work with everyone to help close the gap on food insecurities that our communities are seeing and help bring health equity and equality to all. Thank you.
Good morning, everyone. I'm Overall Dwyer from Love Our Nation. We're in Dania Beach. Hi, Areli. We're in Dania Beach. We partner with The Patch, and we partner with C.W. Thomas Park. And I'm always looking for amazing opportunities for our children. Thank you for inviting me.
Hi, I'm Jamie with the Dania Beach Patch. And thank you for inviting me. I work with The Patch under a USDA grant to provide mobile markets to underserved communities and in Broward County. And we are looking for more locations as the COVID restrictions start. and also to provide assistance in helping other locations start market gardens and ways to share produce and get what we grow to the people. And again, thank you.
Hello, everyone. This is Nadine McCrae. Can you hear me?
Yes, Ms. Nadine, loud and clear. Welcome.
Excellent, excellent, excellent. Again, my name is Nadine McCrae. I'm founder and president of Community Enhancement Collaboration. And the reason why I am here is because I love partnerships. Partnerships get the job done for the community. So thank you for inviting me.
Hi everyone, my name is Louis. I was invited by JC and I'm here. I'm glad to be here with you.
Good morning, everybody. My name is Sue Gallagher, and I'm from the Children's Services Council here in Broward. And I was invited by Aurelie to be on this learning journey and this co-design process with you all. So very excited to be here to contribute to the good work that you all are doing. So good morning.
Hi everyone, my name is Sabrina Havayana. I am a city commissioner in Hollandale Beach, and we've partnered with the Patch before, but this is so important to me because food access, especially as a result of COVID and unemployment, has been a huge issue in South Broward. So thank you for having me.
All right, any other people that would like to say hello?
Say hi. Hey everybody, my name's Tiara. I'm actually a part of the UHP team as the community outreach assistant, and I'm really excited to be here, really. So can't wait to get started.
Hi, good morning. This is Kirk Engelhardt, Vice President of Marketing and Communication at the Community Foundation of Broward. Love seeing everybody on here and look forward to working with you to get the good word out and make sure that a light is shined on the positive and, as we say at the foundation, the bold impact you're going to make in South Broward. So thank you for being here today and for all of your hard work and your willingness to make this come to life.
Good morning, Sherry Brown. I'm Vice President of Community Impact at Community Foundation of Broward, and I'm thrilled to see everyone on this Zoom call. I think this definitely exceeded my expectations of who would be participating on the kickoff. So we would really love to hear from everyone to introduce yourself and your affiliation, because this work is about you and what you want to make happen in your community. And without your voice and without your direction, it will not succeed and make the impact that we envision. So I'm just thrilled, and thank you to Aurelie and her team for putting this together. This is going to be incredible. Everyone working together, working on the same page to accomplish big, hairy, audacious goals is the way to go with this type of work. Thank you for being here.
Good morning, everyone. My name is Natalia Earl, and I'm also with the Patch. I partner with Jamie. We're a team here at the Patch, and if you're not familiar, I know we've said the word Patch a lot, but it stands for People's Access to Community Horticulture. And it's originally, of course, started out in Dania Beach, but it was never meant to stay there. So that's part of why I'm involved here, and Jamie and I are really excited to be a part of this because we want to see it grow beyond the bounds of Dania and affect and impact positively so many more people in Broward County. So I'm really excited, and I'm just glad to see how everyone else is excited as well. And I'm grateful to be here.
Good morning, everyone.
My name's Rihanna, and I'm a community member just here to learn more about your impact and what all everyone here does and learn more how I can help my community.
Ivan, please go ahead.
Good morning, everyone. My name is Ivan Rodriguez. I'm a senior public health student at NSU, and I'm a practicum intern for UHP. So I'll be working on the policy scan portion of the project.
And good morning, afternoonish, everyone. My name is Anthony Oliveri, and I'm part of Feed LLC, and I've worked for 10 years in food access. And I'll be working with Ivan pretty soon on training how to do the policy scan for land use policies related to food access, and it'll also help us provide a geographic picture of all the great efforts that we're going to be doing in the South Broward region.
I think we only have a few people left, so if you're able to share who you are and why you're here, that would be great.
Good morning. My name is Maribel Ludovici. I'm also a community member in Broward, and I'm very interested in learning more about the organization because, yeah, I would love to join it and do the best I can to help the community.
Good morning, I'm Jim Yavardi. I've worked with UHP in the past on other initiatives, and certainly this is a worthwhile initiative moving forward. In any way I can support them, I hope I can do so.
Good morning, my name is Elizabeth Caristo. I'm a local community member and business owner, and I've been volunteering with Mobile School Pantry with Zana. And it's been a rewarding experience, and I'm looking forward to getting more involved with all of you. Thank you for having me.
Hi, my name is Kathleen. I'm a senior public health student at the University of Miami, and I'm also a practicum intern just like Ivan this year with UHP, and I'm working for Food for All Broward, and I will also be working with Anthony on the policy scan aspect of looking at different ways to improve food access in Broward County and Miami-Dade.
Sorry, I don't know what I did, but I went back in our slides. My apologies. And I think we just have Alba Rubio from our team and somebody else on a phone join in. So we're doing brief introductions, your name, your organization, and just why you're here. One quick, like 2 words of why you're here.
Hi, my name is Sally Pope-Smith. I am the evaluation coordinator with Urban Health Partnerships, and I will be helping with the evaluation and sustainability for this project.
Hi, everyone. My name is Alba Rubio. I'm the administrative and communications specialist at UHP, and I will be helping on the communications aspect of this project. Nice to be here.
Thank you, everybody. Am I missing somebody? I don't want to jump ahead and forget about anybody. So please, let's last minute for people that would like to share who you are and why you're here. We're taking note and we're going to keep track of all the information, but really reminder, if somebody from our UHP team can copy paste the link to the South Broward Community Health Hub Partner Database and put it back on the chat for those that maybe joined a little bit later. That would be very helpful too, because that's another way which we capture everybody that's here today and keep track and make sure that we keep you on the loop of everything that's happening. You'll learn more and more as you go ahead and into the meeting today about how we're going to stay together and coordinate and co-design this effort together. So it is really important that you do fill out that form that way we can have all of the right information, all of the right emails and phone numbers. That way we don't lose track of anybody, please. Thank you, Jesse. And Jesse, you haven't introduced yourself, so why don't you go ahead and introduce yourself too?
Sure. I'm Jesse Cosme. I'm the training and outreach coordinator for UHP. So for this project, I'll be supporting our community liaisons in informing the project from the community's perspective and connecting that to our outcomes, our partners, and things like that.
Thank you very much. Anybody else that's missing? All right. Wow. I just got to say that this meeting is just bringing me so much life, seeing so many different partners here, from community members, volunteers, the partner organizations, the funders. This is how we will make change happen. And it's just really bringing me a lot of joy, and it's warming my heart that you all are here, because we all believe in this mission and we are all going to make it happen. I believe in each one of you, and I'm so grateful for your time. So if there's nobody else that needs to say hello, I'm going to move right ahead. And don't forget to fill out the form. All right, so this part, Andrea already kind of helped me get started. And as you'll see, just as a Anthony and I like maps and giving people locations. So you'll see little numbers on the top. Those numbers are related back to our outcomes for this meeting. So we'll share the recording, and we'll share the meeting slides as well, so that if you want to go back and read through and go back into, which objective is met at each of the points, right? So as Andrea noted, we are a community-driven leadership organization. We really believe, and that's really, I see that circle as arms that hug everything we do. And then all the channels that lead to building a culture of health equity through our programs. And as Andrea did note, we do this through co-design, through investing in the communities, and through working with community leaders like a lot of you that are here today. So thank you all for joining us. We know that taking the time in your days to be in a virtual space with us, it's sometimes overwhelming these days, but I'm so grateful for all of your time. And today, as Andrea also noted, we will be discussing our food access, justice and security project, the South Broward Community Health Hub. We still have some people coming in, so I'm just making sure they're coming in. All right. As a brief overview, Urban Health Partnerships has 3 projects that deal with food access, security, and justice at the moment. There is 2 in Broward and 1 in Miami Gardens. So the Food for All Broward is our longest, and the reason why we're here today, because it has led to the successes that have given us the opportunity to coordinate this effort. Then we have our South Broward Community Health Hub, which is exactly what we're here for today. And in Miami Gardens, we have a Go for Healthy Growth campaign, which is going to be looking at a healthy nutrition policy for restaurants in Miami Gardens. So as you'll see, the kind of common thread through our food access, security, and justice work at UHP is that we start with access because we have to get access first. But then the idea is, how do we make sure that the access doesn't just end with one-time activities or with things that just will end at some point, and we really build into that security so that people can be secure about their food, about their health, in their communities, where they live, where they work, and where they grow their families. And also leading into justice, which is really to helping us take a look at the past and why are we here? Why do we even have to look at food access as an issue? Why do we have to build food justice? Well, because there's been many injustices that have led us to today. And by looking at how do we move the needle from access to security to justice, that's what all of our food access, justice, and security projects look for. We want to move to that justice piece so that we can better the wrongs and improve into the future. You already got a chance to meet a lot of our team, but one of the things that it makes us a great coordinating effort is that we're a small but mighty, multidisciplinary and diverse support team. We have people like Sally that does our evaluation and monitoring expertise, Jesse with training and outreach, Alba with communications and administrative support, Beth, who is our policy assistant and looking really closely, working with our interns and looking at those policies that are going to help us sustain this effort. And then also our CEO and COO and our other department directors and our community liaisons that are all part of this really great multidisciplinary and diverse team that brings all of our expertise and love for the work that we do and passion, so that we can help and support, grow these efforts for all of the partners involved and as a collective. For this project, we also have 2 expert support partners, Anthony Oliveri with FEED and Natalia and Jamie with the Dania Beach Patch. FEED will be more specifically around our GIS mapping, data analysis, policy scan, helping us really understand the policy mapping around South Broward and what are the things that are going to be needed for us to push as well in terms of policy systems and environmental change that will help us grow as a collective and help us really sustain the long-term effort of the community hub. And similarly, the Dania Beach Patch, with their expertise in working as a market garden that brings economic development and revenue sources for community members that are working in the gardens, and for the partners that are involved in the gardens. That's another piece that we will be looking at in terms of that sustainability. What are the business plan ideas that we can build together so that this effort is sustainable? We also have great, again, continuing with this multidisciplinary and diverse team, we have our wonderful interns, Kathleen and Ivan. You already got a chance to say hello to them. They are amazing senior students in public health at different universities. So even just having that different perspective, different ways of learning about public health and bringing those to our projects and focusing on what policy gaps exist in South Broward that we can hone in on. They're going to be leading those efforts. So thank you so much for joining us today too. And it's been a pleasure working with them. I really believe in student learning. And our wonderful community liaisons. Rosemary Morales is actually sick today, so she won't be able to join us. And we sent her all our love, that she recovers fully. And Tiara Jackson, who you also met earlier. Tiara actually has been a community liaison with us for about a year now, going into a year now. And she's actually grown in that position. And now she also plays the role of an outreach assistant within UHP. So that just speaks to the testament of our community liaison framework, which is that community-driven leadership. We really believe in hiring and working with community members to build connections, to help us integrate with further expansion across their communities with the local partners and stakeholders, local businesses, community members, churches, etc. And then also building their support capacity, building their capacity and helping them do that for community groups that exist. One thing that is really exciting about this particular project is that we are able to expand this community liaison framework through our partnerships. So we'll talk a little bit more in detail about that, but some of the partners that got grants for pilot programs or mini grants for this effort are already hiring community liaisons. And it's a really exciting thing to see that by building community leadership and really establishing the connections with community leaders and then having them expand that reach and expand that collaboration and expand that feedback and helping us build a better feedback loop for our projects and our efforts. We're building that sustainable change, developing together, growing together so that we can reach those big policy systems and environmental changes that will help us lead to long-term sustainability for our efforts. So I want to take this moment to really applaud and appreciate every single community member that is in this meeting today. I am so grateful that you're here. I know that there will be opportunities for us to connect and help grow your leadership in the community. So please continue to stay connected with us. The role of the community liaison, more outlined, is to connect, to develop, to integrate, and to help build sustainable change in the ways that I shared. It's partly individual as a community liaison, but also as a collective, building towards more access, more connection, more development, and more integration from community members, and community members also informing and guiding and leading the sustainable change that we're building together. The same way that we're doing that with partners, we do it with community members so that together we can co-design the goals and efforts for this project. So now moving on to the project itself, this collaboration is a vision that started with the Community Foundation, trying to think differently and approach our partners and the fundees and grantees in a different new way. Bringing people from different areas in South Broward together, coming up with ideas, and that's what sprouted this little grain. And we're going to continue to build from it. This right here is our mission in a very draft form, because again, this is just something that we've put together from collecting information from the different partners that we've started working with already. But our goal is to then establish something that's going to be capturing all of our goals. So to start, the South Broward Community Health Hub collaboration engages and partners with local stakeholders and community members to co-create solutions for residents who are food and health insecure. And this project is funded by the Community Foundation of Broward. Oh, hold on, I can't pass. The shared vision of the Community Health Hub is to coordinate community-driven and equitable food and health access activities, services, and opportunities, to leverage and strengthen local networks. And Wait, I just realized we're not recording this. Oh no, we are. Whew. Sorry about that. leverage and strengthen local networks and communities to produce, because another thing is we want to share this recording. We want to make sure that we can share this information with more people. So my short slide freak out right there was because I thought we were not recording, but thankfully we are. Thinking ahead, sometimes I forget we do that. Leverage and strengthen local networks and communities to produce, provide, and procure food, health, and other resources and opportunities, and connect these opportunities and resources in ways that are accessible and inclusive of all backgrounds and abilities for an increase in physical, social, and economic well-being and success. Like I said, this has been a collection of information that has come from the start and inception of this idea of the collaboration and the South Broward Community Health Hub that has been led by a lot of the partners and community members. But in the end, our goal is to build a local network for food and health access solutions in South Broward. And why we say solutions is because they're diverse, right? As diverse as we are here in this meeting and as diverse as our South Broward communities are, we really want to bring those solutions from the different perspectives into this. All right, and some of the desired outcomes in a bigger, broader picture terms are healthy food access toward food security and justice. And I highlighted some partners that are already doing some work in this area. We're obviously at a baseline level and we want to keep building from it and growing together. But I just wanted to highlight, and if some of the partners that are here today could go into this areas, we're going to actually update this based on your input from that partner database. We ask you a few questions in there of the work that you do, so that then in our next meeting, when we have this slide again, your examples appear there as well. Access to health, our next desired outcome would be access to health services, resources, and opportunities. Obviously, Memorial Health Hospital is doing that. For the healthy food access, we can highlight Melville School Pantry and the Patch. Coordinated community resource connections. Right now we have a mini grant partner, Be the Drop Foundation in Miramar, who is linking up the faith-based organizations to make sure that they can coordinate better and communicate and share expertise and opportunities. And then economic development strategies and collaborations. The Food Access and Community Empowerment Solutions Project is another mini grant that is led by the St. Ruth Missionary Baptist Church team. And they're looking at how they can use economic development opportunities through food to help build the community in Dania Beach. Some other leading partners that we've been talking to already, again, we will keep, that's why there's 3 dots at the bottom of each one, because we know that we want to continue to grow and build with more partners. So if you are here today, just expect your name and organization to be there for our next one. But just we have municipal support, we have county wide efforts, and then we also have the community-led approaches and community-led efforts. This is kind of our grant outcomes. One of the key things that makes our projects successful in general, and especially collective impact projects and collective collaborations, is clarity. And one of these things, this is our grant goals. And that's why I wanted to have everybody see them, because our goal is we want to overall form and implement the South Broward Community Health Hub. We will create short-term solutions that will generate greater access to food and secure residents. And the examples from St. Ruth Missionary, Be the Drop, and the Patch and community enhancement collaborations, the Pantry in Hollywood, those are all great examples of those short-term solutions. We also want to create the groundwork for long-term sustainability, and that's why we really want to build on this. How are we going to build better healthcare and food access and help eliminate food deserts and improve the overall health of our community members? We also will facilitate some recommendations back to the Community Foundation for additional grant opportunities for some of our partners in the South Broward community. And also facilitate and track, so monitoring, making sure that we keep track of everything we're doing so that we can have a better story to tell, right? In a way that is captured in a way that highlights all of our goals and all of our efforts and every single person that's involved, our village. And evaluate the improvements that we may be implementing in the environment, right? So there might be opportunities to go find a location for somebody that needs a location to grow their efforts. So maybe we can highlight, right now, St. Ruth Missionary is actually looking and going through a permitting process to put together a shared storage space, starting small with the goal of being bigger, obviously, but we will talk a little bit more about through the process, but just wanted to highlight these. And on the right, you have a little bit more of the process objectives that are very helpful for us to share, that we are really trying to build a long-term vision through our community action planning process that will take 8 steps. Today, we're going to be working on step 1, which is developing our goal. And it's really that shared vision, right? But then from there, on our next co-design meeting, which is we will be scheduling today for March, it'll be where we kind of go into steps 2 and 3, building the knowledge. Actually, we'll start on 2 a little bit today. But that 8-step approach will be our guiding effort of bringing all of the partners together, community members, stakeholders, funders, organizers, volunteers, and everybody, so that we can keep building on that vision through those 8 steps. And we will be guiding the process so that if there's any questions or concerns, we can always be there for you.
Really?
Yes.
Yes, I just wanted to share with the group, from the Community Foundation standpoint, the process that we're using with the South County Health Hub is quite unique and different than how we've ever approached grant making in the past. Because typically we have an open RFP and organizations are allowed to apply according to the RFP objectives and et cetera. But what we've done with this model is we've actually hired your organization as the lead agency to serve as kind of like the screener, if you will, of projects that subscribe to the goals and objectives of the South County Health Hub, so that everything aligns. So the organizations on the call, if they have projects that will meet the objectives that this entire group is fleshing out, they have to actually go through you for that pre-screening, and then you will in turn advocate or make the recommendations to the foundation on what needs to be supported through the hub. So that's why the partnership is critical with this group, and don't look at it as a competitive process at all. Like St. Ruth, they defined a need. You know, we talked last summer about the storage area, and at the time we had a few organizations a part of that conversation that said, yeah, that's a great idea. We can use the storage space too, because we're running the Pompano to pick up milk and things like that. So yeah, if you want to initiate it and have it hyper local here in Dania, in this community, then we all will benefit. So the grant went to St. Ruth, right? And they're a first-time grantee of the foundation. Now we grant the money directly to the organization, but the vetting process is definitely done through UHP, and with Angelica and myself really screening the proposals in relation to the objectives of the South County Health Hub. So it's very important that if you guys, are communicating with each other and staying connected about who's doing what and how to best get it done. Because it's not about competition, it's who can best get the job done with whatever component they will propose as a part of this. So thank you.
No, thanks for sharing that, Sherry, because that actually moves us on to our next piece, where we're going to be talking a little bit more about the mini grants. And I think one thing that I would add is that UHP also comes with our technical assistance and support. And when the mini grantees for the first round, which was kind of like the fast lightning round, I would love for them to share a little bit about what that technical assistance and expertise that we bring to the table in coordinating the effort of getting those grants and supporting you along the process. Because that's another way that we benefit all together. And another thing too is we really encourage collaborative approaches, right? So the example that Sherry just shared, what came from, actually, I think it was Bishop Scott and Zaina from the Mobile School Pantry that kind of were like, yes, storage space. And then it kind of just led to that mini grant. So anything that's going to be, and then there's the other one with Community Enhancement Collaboration that is a partnership with the Patch to collaborate and bring fresh food markets to the community in Hollywood. neighborhood. Those are examples of the types of mini pilots that we're trying to recommend for the community to fund. So yes, stay in the loop, keep talking to us, come to the co-design meetings, be part of the process. For community members as well, we are really trying to build community-led efforts as well. So if you are on this call and you are part of a church or part of another nonprofit that you know there's a great idea, let's talk. And I will have all my information and details, and I think everybody here already has them, but still I'm here to help lead that effort and coordinate it. So let's keep doing this together. All right, now moving on to just a few other updates, right? I'm going to pass it on real quick to Anthony, but I'm going to introduce the mapping and GIS, kind of like our initial research and idea of what we want to showcase for you, because this is going to be a really important part of our process in understanding. Let me check on time too, because does everybody want to take a 5-minute stretch break? Because I know Zoom sometimes can be a little bit too much, and I'd already been talking too much. So it's 11:55, so it gives us perfect 5-minute break. We'll be back, and then we'll just kind of hit the ground running with the next phase. Does that sound good? Stretch, go to the bathroom, go drink water. If you haven't eaten, eat, because food is very important, and we'll see you in 5. I'm still here. Anthony, are you there?
Yes, I am.
Okay, perfect. I was wondering, I just want to briefly share the map. So I was wondering if you want to kind of like share it and you show it, or if you wanted me to do that while you kind of share our vision with this map. Are
You want to show? Yeah, you want to show the static image that I inserted into the PowerPoint last night?
Yeah.
Yeah, so let's just do that. I'll just briefly explain it's interactive.
Perfect. All right, we'll do that then. It's already in the slides and you can just talk about it.
Yep, exactly. Thank you.
Awesome. Thank you so much. And for those of you that are still hearing my voice there, please don't forget to fill out your partner ID or the South Broward Community Health Hub database survey. If you have some time, this would be a good time. Again, as I said, this is a really great way for us to make sure that we know who's here and who wants to be part of this project and collaboration. We'll have one more minute and then we'll start it right away. All right, I am going to give a few seconds for people to jump back on, turn your cameras on if you want, or just stay on your name or picture if you want. Again, no pressure. We know Zoom can be sometimes a little bit too much, so we're patient. And if also, I'm just gonna use this time to say, if you need to step away, we have at least another hour of time together. So if you need to step away at any moment, please just make sure you mute yourself and take your video off if you can, so so we don't get distracted. But please do what you need to do, and completely understandable. If anybody has to jump off at any time, you got my information. And if you don't, I'll make sure to put it on the chat right now. Please contact me and I can send a recording of what's left. We can have a separate meeting. Again, we're here to support everything that's happening through this collaboration in every way that we can. All right, so now let's get started. And Anthony, we're sharing this image. It's a static image, but this is actually a very lively place. I do have the link in the slide, so eventually you might be able to actually see it. But Anthony, can you share a little bit more about what our vision is for the use and employ, but like how we're going to be working with this map, what it's telling us, and what we can do with it moving forward as part of the collaboration, please?
Sure, no problem. And hello again. My name is Anthony. What you're seeing here is an older draft of an interactive map. So what I like us to do is be able to map our efforts in the South Broward region. And what you see here are colored, and the colors is the rates of diabetes by neighborhood, otherwise known by census tract. The greener it is, the lower the diabetes, or redder, orange, the more diabetes. The updated map that's now showed West Park and Howdale, which is all red at this time. And the little green points you see are food distribution points from Together for Broward. And the area we see a dark border, that's the Seminole Sovereign Territory. You can see that area of the Seminole Territory is a high diabetes area. What's not on here, which would be great for us to populate, and of course, all the hospitals and we also put the clinics that are still affiliated with more health systems will be on there as well. What's not on here, what we're going to do, what we could do together, is put all your efforts. So all the faith-based efforts, the cold storage facilities, the pantries, all those points that make the hub work in place. We like to populate this, and we also can put photographs of those points. If you click it, you get either a YouTube video or the image of what's going on there. And eventually we could populate this map. We could make a story map out of it, where it's not just a map with dots on it, but we actually, we could tell a story, literally tell a story with text and images about how these efforts are connected.
Thank you so much, Anthony. And yes, this is really a great tool that helps us understand the scope of the region, right? We will use this more in our co-design meeting #1, which will be in March, and we will schedule it together at the end of this meeting with the updated map. I apologize, actually, it didn't update. Anthony changed the image in one slide, but the one that I pulled up, it didn't pick it up. So it just has more red in the area that we are in the center. That's really basically what the difference is. But the idea is that by understanding the geographical, the visual of where we are, we can better apply our implementations and our projects. And then also, like Anthony said, this can be a way for us to highlight our efforts and the way that we work together and our connections and your programs and your activities and everything that you're already doing. So this is another plug for this database. One of the reasons why we really would like you to fill that in, and the reason why we asked a few questions about your contact, tell us a little bit more about the organization, tell us a little bit more about your programs. And we also have an option there for you to upload some pictures, is with that purpose. We want to highlight every single one of you in this map so that when come the March meeting and we're looking at the map again in the interactive version, you'll see how that populates and how the information from your organization is on the map as well. And there's opportunities through Anthony and Feed to also ask his expert support for this project to make this into an interactive map that is also broadcasted to the community. So we will be having those conversations, and if that's a way that we want to move as a collective, we can make that happen.
And also just want to bring up one thing. So it's not just a map just to visualize things for the sake of visualizing. Going forward, maps and my experience working with nonprofits and other organizations can help also get grants. So if you could show geographically how you're connected in your partnerships and how they're working together, that's very good for USDA grants.
Yeah, and another layer that Anthony and I and our interns are going to be working on adding to is a policy scape. So where are our policy deserts? Where are the policy swamps where we have policies that talk about food, but not in an effective way? Like if you are just opening up land use to build food access without a clear determination of how that food access is going to look and what type of food is going to come in, you're creating potentially more problems. So another layer that we will be adding to this map will also help us see where are the areas where we need to do a little bit more work on the policy side. And another partner that couldn't join us today, but that would be helping us very closely in this effort would be Florida Impact to End Hunger, which also has done great work in policy systems and environmental change across the southeastern region of Florida. And we are working with them too in other projects to build more of that knowledge. So again, this map, expect to see it a lot more, and we will be learning how to use it together. We will be learning how to put more information in it together, and then we will be deciding together what we do with it. Another great thing that has been, oh wait, hold on. Can you still see my screen? Oh, that's the actual interactive map. I clicked on it, my apologies. Oh, that's the updated version. I don't know, can you see it?
No, we only see the PowerPoint because it's shared to the PowerPoint.
Right. So I clicked on the map and it actually took me to the map. But then the other thing, I'm actually going to take a break and not say anything else, but I would like for our mini grant partners to just share briefly what you're doing. These short-term solutions that the Community Foundation of Broward is also funding are aimed to provide short-term implementations that help us pilot ideas that would potentially build the capacity for our partners and the communities to continue to be a part of this project. And we are as part of this effort and our technical assistance, our goal is to also help them build sustainability for these efforts. So Ms. Darlene Riggs, would you like to share a little bit about the Faith and Food Access Network? If you're still there. Maybe she's not there anymore. All right, she's busy too. I think she's but let's move on to then Bishop Scott, Deacon Jones, or Ms. Gloria Black. Is there anybody that would like to share a tiny little bit about the food access and community empowerment solutions, the shared use space?
Thank you, Aurelia. This is Bishop Scott, and thank you for allowing us to be a part of such a great partnership. We have been since March of last year working to create sustainable feeding program in our community. We started with the children, making sure when schools were shut down that the kids had something to eat. Our school in our immediate community was left without that care. So we took it upon ourselves to do it. It kind of became the birthplace for everything else we began to do. We started out caring for the children with a partnership with United Way, PDQ, McDonald's. There was one other company that donated food to us. we raised some money. We had some commitment from the hospital district to help us, and we fed them for several months. That kind of turned into partnership with a group called World Vision. World Vision started sending us trucks with 23 pallets of boxes, and that kind of turned into Al Jones connecting us with Flippany. Flippany started sending us trucks, so we had 2 trucks on Tuesdays and 2 trucks on Thursdays, and we were getting it out as fast as it was coming in. That allowed us then to pull in other communities. So we reached out to other churches. I think, still staying in the vein of partnership, we included about 24 churches, I believe it was. And of those 24 churches, we began to help from what we were getting in to give to them to serve in their areas. And that's from Miami all the way to Port St. Lucie, I believe it is. And that kind of pulled in, I guess, being noticed. Southwest Airlines started sending us cookies and other snacks. And then just people from around the communities, Hollywood, started partnering with us. And that went from veggies and fruit and veggies to chicken, meat, milk. Borton's also partnered with us and gave us milk to be able to distribute. So one of the reasons we wanted to a storage, and again, I got to thank Al Jones and the others who are on here who were part of that original collaboration, that conversation. I wanted a storage. And my mind was, let's find out how we can build a building, and because I want to be able to make this sustainable. I want to do this. I don't want to stop with just food. I wanted to be able to take it another step further. We were looking with World Vision and another group to possibly start adding household things that, of course, we would have to give away. And so the storage for me was not just for food. We were looking for something to be able to put refrigerators and stoves and things of that kind in to be able to give away to people. And that, that brought about great relationships. Again, I got to say thank you, and postured us to be the recipient of this first grant to continue to do what I believe is going to be sustainable work in serving our community. And it's smaller than what I had envisioned, but I'm taught early on never to despise small beginnings. And so we appreciate the effort and look forward to it mushrooming, if you would, into something much greater, much grander. And as was mentioned earlier, this isn't about a competition or anything like that. It's our passion. It's our heart. Anyone who knows Al Jones or knows Gloria Black, I'm the new kid. You may not know me. I'm not from here. I'm from Texas. But you know these two people, and if you know them, then you know their hearts are always to serve and to lead in serving others. And it's my passion as well. And so it's been a great marriage for me coming to this church, this city, with this group of people, and then now with the rest of this group. It's just been a great marriage for me, and I'm excited about the other things that we will get ready, be able to do in the future. Hope I didn't go too long.
No, I think it was perfect because you gave us a really good scope of all the work that you've been doing and how it led to this effort, learning that storage was needed. And again, I would say we're starting small, but with the idea of building big. So, it's not just this, there's more, right? You really are starting with the short-term solutions to try to build bigger and better. And actually your proposal talked about your future vision of building community health work and other aspects of job development. Community. So those are things that are still part of our goals, collective goals. And I think with all the group here, we will be able to do that even bigger and better. So thank you so much, Bishop Scott. And where in Texas are you from?
Houston, Texas.
Oh my goodness. I'm gonna be driving back that way soon. I'm actually in Austin right now. And there was so much going on this past week with the cold out here. I can share more about that when I get back, but because I'm gonna you. So So we'll talk then.
Yes, yes,
Thank you so
indeed.
much. Thank you.
Thank you.
And then Ms. Nadine, are you still on the call? I don't know. She was going to be joining on the phone, and then also she was picking up her granddaughter. So she might be a little busy, but Jamie or Natalia, I know we're still in the planning phases for a lot of the Fresh Success Mobile Market collaboration, but we have a lot of plans moving forward. Do you want to share briefly what those plans are? All right. I don't know if Jamie and Natalia are there.
Arlia, I don't mind sharing.
Oh, I'm here.
Yes.
Oh.
But yeah, Tim, hold on, Natalia or Jamie, I don't know who it was, but Tim, you're very close.
Nadine McCray is here. Hello.
Oh, perfect. Okay, so Ms. Nadine is with Community Enhancement Collaborations. She's been supported through Memorial Health and Tim Curtin over there to build a pantry in Hollywood that has been serving actively throughout the pandemic in more ways than one. And with the Fresh Success Mobile Market collaboration with the Patch, the idea is to inform the community that there is additional produce for purchase, that there will be additional produce for purchase at the location. So Ms. Nadine, I know we've been building towards this. There's a lot of things that we have had to finish on the background, but we are planning to start some fresh markets coming up. Is there anything that you'd like to share about your mini grant or your efforts?
Well, number one, I'm very thankful and grateful that you guys awarded Community Enhancement the grant. As you know, I love partnership. I've been involved for a long time. But one of the things that we are doing now is because there's a need, since this COVID-19 hit, the numbers have went through the roof. And there's many agencies that has closed. There's a lot of nonprofit organizations that have actually closed. They're not even much open. I'm not sure if they're going to open or not, as well as there's some community leaders that have nonprofit that had died from COVID-19. So we all are just trying to fill in the gap where we are needed. And so so what we are doing now is we are providing, we did receive funds from some funds from United Way. We also received some funds from Children's Service Council of Broward County, my first grant, and it's providing where we could go out and provide mobile pantries. We provide on the road mobile pantries. And we also provide food. We provide essential items, toilet paper, bleach, laundry detergent, toothpaste, personal items for the women's, personal items for the men's, meat, whatever the stores have and sell. We have been able to create a little small mini supermarket that we actually bring and we set up. And each time, I just did one at Gulfstream Academy yesterday, and each time I leave, they are very impressed with the things that we are doing. We had one at Hollandale, and everybody wants us to come back because the families receiving everything. Not only do they receive food, they're receiving the personal item. Some receive clothes. If we find out that there's a family that need diapers, we bring diapers. If they need a car seat, a stroller, we bring that. And these are new items. We have partners that are actually donating lots and lots of new items. We bring in pretty much over 400 baby items a week. We pick them up twice a week. So we are able to donate these items back out into the community. And we bring it in probably about 60,000 pounds of food a week. And of course, we bagging it up and boxing it up. We also doing deliveries. We have Memorial Hospital has been a great partners in helping us deliver food to seniors, to the shut-in, to people that has COVID-19. So we're doing way more than we ever imagined that we would do, but at the same time, we are happy. So we are looking forward to working with the Patch. working with all you guys to provide more. We provide milk, whatever the stores have, we have been blessed to get those items and get them out into the community. So I'm just here to work and get the job done. And computers. Someone donated us computers. Somebody donated 2 brand new generators yesterday. 2 brand new generators. So what we are doing now is just building a database. So when people call, I need a bed. We have beds that we got furniture. The only thing that we are missing right now is 2 things. And one of them is data support. We need more people that will help us input the data into the computer system, because we are a member of Feeding South Florida also. And we need storage space. My place is only 1,300 square feet. And before COVID-19 hit, we were setting it up like a dollar store. You go into the dollar store and you see the coolers and you see the freezers, because before COVID-19, the clients they come in with a shopping cart and they would actually go through the aisle and pick out the food that they eat, because you have people that, because of religious reason or because of health reason, we want to make sure if you didn't eat pork, you ate chicken, or you ate fish, so we have all of those items. And if you ever want to take a tour of it, in the next month, it would be great. You'll come in and you'll see that is set up like a little mini supermarket, so United Way is coming. The president of United Way is coming to visit me on March 12th, I believe, because he wants to see more of some of the things that we are doing. So we are here, and anything that we could do to help, looking forward to working with the patch to do some things and get some things done. So thank you. Hello? Did they lose me? They must be lying.
No, we got you, and we heard everything that you shared, Ms. Nadine. Thank you so much.
I'm glad. Thank you.
No worries. Thank you. And I just wanted to really quickly just share too that we're going to talk more with all the partners now. But one key thing that all 3 of these mini grants are also helping support is building community liaison and community driven efforts of finding people to support with the data collection. So building the capacity of our partners so that they can do more of what they're already doing so much of. I think Ms. Darlene Riggs from the city of Miramar already brought the just probably recently hired community liaison that will be helping with outreach. So these mini grants have done so much in terms of building opportunities for community members, but also expanding the capacity of the partners that are leading this effort so that they can continue to do more, bigger and better. So let's continue to build on these projects and build more projects like this that will continue to serve the communities in South Broward. Now we will get back to this. This is our timeline for the project, some of the key things that we'll be talking about. The highlight of this is the co-design meetings where we will be having time to talk about the vision, build it together, talk about the implementation, who's going to be doing what, or how can we support and find additional ways to sustain the work that everybody's doing. So I won't take more time than that because I really want to hear from you. So now we are going to move into our, I'm going to switch the screen. We're going to move into a Jamboard. If somebody from our UHP team, I think Jesse, you might have already access to the Jamboard. So if you could please put the link on the chat. There's a link that you will be able to access, and then I'm going to share my other screen so that you can see that. And I don't know if Jesse's there, and if not, I'll share it as soon as I am able to.
Could you explain quickly what a Jamboard is?
Yes, a Jamboard is actually a link that takes you to another set of slides, but that are interactive. So with the Jamboard, it's another set of slides. I'm going to put it on the screen so that you can see it, because it actually does help when we see it. 1 second. All right. And it's called Jamboard because Google called it Jamboard. And I think, now let me share my screen. Is this it? Yes. Okay. And Jesse, thank you so much. He just put the link on the chat. and you'll be able to access and join in. As you'll see, this is the Jamboard. It looks like a set of slides. People are joining. You see anonymous shrew joining. They give us, if you don't have a name or a Google account, it usually gives you an animal, but they're really cute. So people keep joining in. And as you can see on this left-hand side, you have what we will be using is going to be this Post-it notes, and you can change the color.
Yeah, Relly, it may be showing up as view only for people. You may have to open the share settings.
And I think I did open the share settings, but I'll make sure. Anyone on the internet with this link can view.
Okay.
Maybe, is it just view? Wait, hold on, let me see. Oh, it's viewer. I see what you're saying. It's editor now. Okay, done. Maybe let's reshare the link or actually, no, you could just refresh. So if you were joining and it wasn't showing you this little thing on the side, if you just refresh right here, it should give you the other view, right here. Okay. All right. Yeah, people are moving it now. Okay, so everybody's got access to it now. Okay, let me move that because that one was actually a picture that I had already created, my bad. But let's start with, if you could put a couple words, or if you could just say a few things. I use this tree as a way to showcase the vision of our South Broward Community Health Hub, because right now we're setting up our roots, right? We have these partnerships, we have all of these team members or group stakeholders. We want to make sure that we are rooted in health, rooted in equity, rooted in community-driven approaches, rooted in justice. And then those, the trunk and the branches are those things that are going to help nurture the tree, right? And nurture our fruits. So economic development, capacity building, food and health access, health opportunities, business opportunities, other things that all of you bring to the table that will help us uphold and nurture our tree. And then at the top with the blue, you see kind of like the fruits that we want to see, right? The fruits that we want to harvest: food security, community wealth, health equity, community ownership. I want to give a couple minutes to get started for people to add anything else to this tree, either at the root level, at the trunk and branch, or at the fruit side. And how you can do that is by clicking on this links right here on the left. It gives you a sticky note and you can type right there, you put save, and then you can move it to the place where you want to see it, okay? So let's take a couple minutes to do that. And if you are not able to, let me know. I can try to troubleshoot some things. All right, and if anybody wants to shout out, if you can't type it on, if you can't join for some reason, or if you want to just shout it out, something else that is of interest to you and your organization to build this vision together, please let me know and we can type it up for you.
Really? Yeah, Al Jones. I guess it might come under healthy opportunities or dealing with the community health workers training. And maybe they can get certified and so forth. I think you mentioned before that there was some training being done, and I don't know who that was by at the time or who's doing it, but certainly would like to collaborate with them in order to make sure that we have community health workers. And I'm quite sure, I know Tim Curtin is on here, so be able to work with Memorial Healthcare and so forth. And not so much as that, but I visit a couple of places, and one was Jacksonville, and I see they have a network of individuals that have gotten certified in community health and being an assistant, and certainly to our elderly who right now at this time during the pandemic and so forth are really suffering. And certainly those that are sick and on a sick bed or at least incapacitated to some degree or physical disabilities per se, really need this. And I'm saying people that can be certified and go into those homes to help them with their everyday daily needs that they have to have. And I'm not talking about home health and so forth, but just to go in and be their eyes, their ears, and maybe their feet to provide some type of service.
Yeah, Commissioner Jones, thank you. And I agree with everything you said. Arlie and I had a conversation last week leading up to today's kickoff, and we started talking about food just being kind of like a symptom of other issues. And obviously economics is a big issue when somebody needs food. But what is housing, as you mentioned? What is their housing situation, their employment situation, even their income and tax returns and things of that nature? For families with little ones, are they linked, or do they have the navigation skills to link subsidized childcare? Do the adults want to better themselves, and maybe there's linkages to adult education and GEDs? Healthcare coverage is a big one, right? So you're right. There's legal issues. There's substance abuse, mental health, folks living with disabilities. So yes, this program starts with food, but I think families who, or the individuals who will be receiving or coming for the food, probably if it's done right, can be quickly assessed for other needs, and then that's where the program continues to grow. Because I guess the collective goal here would be families or individuals who need to use a food bank. The goal would be for them not to need the food bank anymore, correct? And again, there'll be families behind them that will need it. So we're not putting anybody out of business here, but certainly we are trying to graduate people from the need of a food bank, of that level of assistance, to maybe decreasing those levels of assistance through their own economic growth. So that's how I see this program. That would be the concept that I would see. We facilitated a very small pilot project with some of these same pieces, and I think Zena was here when we had hits in the other room, when we had a food distribution at our shop on Taft Street, and we had the families had to come through the first room first, and that's where all the assistance was, whether it was medical, whether it was applying for Medicaid or Kid Care or WIC or SNAP or any of those things. But I could see Career Source Broward being part of this. I could see, women in distress being part of, all the various needs one may have. And food is the hierarchy. Obviously, you need to eat to keep moving, but what are the other needs if food isn't even something that can't be covered by the individual or the family? There's got to be a lot more needs that maybe we could link and assist with. And that's where the community health worker certification comes in. It kind of formalizes their approach. It provides a little more of a skill set and the nomenclature, which is used in the community. And I think it really will benefit this project immensely.
Yeah, just let me come in now, Tim, and thank you for that, Mr. Curtin. Certainly, you expressed it so eloquently, and I really appreciate that. But one of the things is a CNA, a community needs assistance or something along that line, CNA, CHW, whatever that particular acronym or we can use it for. But I do believe that there's just a big need, and there's always going to be that need. And that need was there before the COVID-19. It was there after you come into a home and you find this. And I'm just saying, through the fact that I've been related or at least connected with Memorial Healthcare for over 16 years. And these are some of the things in which Tim was mentioning that we were doing way back when. But certainly now with this group, I just think, hey, the sky is not the limit. we can go and to the space and to the universe with this, because I just think it's something that is really is needed at this time. But certainly, my church has always been that one that's for the least, the lost, and the left out. And certainly, we're going to continue to do that. We want to be a church beyond Sundays, and that meaning that we want to reach out into the community, and we're not just open on Sunday or Wednesday for Bible study. We're open 7 days a week, and we're here to serve the community.
Yeah, and I think that all of the partners here have that love and passion. And I think that's why we're in the right place. Look at just this board right now with all the different post-it notes that highlight that vision, right? The fact that food is our entryway, kind of like it is to our mouth, right? And then it nurtures all, similar to the tree and the roots, and how it picks up all this nutrients and then blossoms into something completely different. So that's why I think we are here together for this reason. And we really can, I think, if we put together the community-based action plan that will capture all of these things, and with our support, draw it up in a way that will be put together, and we can follow the steps to this accomplishment, we can make it happen. And I believe in us. And like Deacon Jones just said, the sky is not the limit. We can go bigger, better, and bolder, thanks to this funding, thanks to this collaboration, and thanks to each and every one of you on this call today, and all of the other ones that will come from this call into the next one. So thank you. I'm going to move on to the next one because I want to learn a little bit more. And we'll share all of this with you, so you can take a look as well. This is our collective vision that we're starting to build. And what I'm probably going to do is I'm going to reorganize it as well, like it was in the beginning for our next call. Maybe there's more vision to add into this, right? Maybe there's going to be new voices that are going to come to the table, and we can continue to add onto this tree that we're nurturing and watering together. All right, so now using the same approach, if you are on the Jamboard, please feel free to just put your name and or your organization, just so you can have like a label, and just find yourself in this space, right? Some of you do more food access work, some of you do some more health access work, some of you are right in the middle doing both all the time, and some of you might do it more consistently because you already have established program or established service that is already funded and sustained, and you might do it all the time. There might be others that do it sometimes as needed or based on the funding that you get. So if you have the opportunity to put your name and or organization in one of these post-it notes, and then located it within this this quadrant, you could go ahead and do that. We really just want to see who's doing what a little bit more visually for everybody to see.
So really, would that be a new link, a new board in the chat?
Oh, no, you just go to the next slide up here, next frame. My bad, I did not, I just switched myself and I just didn't, I thought you were all switching with me. My bad. Just go to the next slide and then, yeah, put right there. Okay, good. I see some of us already on there. If you want me to place you, I think Bishop Scott, yes, I think you have your hand up. Do you want me to place St. Ruth somewhere?
Yes.
Where would you like me to put St. Ruth?
Regularly, consistently.
Perfect. Anybody else that would like me to support with putting you on the quadrants?
Yeah, I just sent you something, Arlie, about health access for Memorial Healthcare System.
Perfect. Thank you, Tim. All right. Ms. I'm going to put, so I think, oh, I have another one. Okay. I think I can put here too, just based on my knowledge of the community enhancement. Ms. Nadine had to leave, but I'm going to put CEC. They do regular, consistent food access work. So I'm going to put them up here too. I also think Be the Drop Foundation does a little bit of everything.
On that tree, did anybody put anything?
I'm gonna put right there. Anything else I'm doing?
Distribution that Connie.
All right, and again, if you want us to add you later on, let me know. We'll share the slides, and maybe you didn't think about it right now, or you were not seeing the screen. That's potential. So if you have that, we'll be sharing this and asking that if you want to put yourself in this quadrant. Again, these are also images that are going to help us tell the story, right? Of like, where are we now? I'm seeing that we have a lot of food and regularly right here, but maybe we need a little bit more health partners, right? Because this is a way for us to see, we need mental health support, we need community health workers, all of those things that kind of came up in our previous conversation. They're being highlighted through this effort right now because we do have a little bit of a gap on that side more. So these are just ways for us to understand better who we are as a collective and how we can build from these gaps and opportunities. So we have opportunities and we have gaps, and we will continue to build from there. All right. If you want to follow me again to the next one, we have one more. If you go right, if you want to be a little bit more specific about your program. So the previous one was about your organization, yourself as an organizer, but if you have a specific program, so for example, Tim, I'm going to pick on you. I think that you have done some health fairs, right? Some health resource fairs. And those ones are kind of in the both area, right? Because you provide food during those efforts. So if you could put, like, maybe I'll put right here, if you let me, I'll put memorial health fairs.
Sure.
That provide both health access, but also food access support. So I'm gonna put it right here in both. Zaina, if you're still on the call, I know that you do your mobile school pantry, but you also sometimes maybe bring, I'm not as 100% aware of, but maybe you bring some health access or nutrition education, or maybe you bring some screening support. If you do that, then you can put a program in both. But if you're just doing food access, you could put mobile school pantry on the food access side. Again, if you have some programmatic approaches, if you wanna place them somewhere, please let us know.
Absolutely. We're grateful for the support of the Memorial Healthcare System. We're grateful for the American Heart Association that gives out materials. So we'll make sure to put us in both.
Thank you so much.
And I think Zena and a few of the others also give out recipes and really discuss with each of these families. And I've seen Zena do it on plenty of occasions, how to prepare maybe an unfamiliar food or unfamiliar vegetables. So there is a lot of health education. There's a lot of nutrition education. There's a lot of cooking education, if you will, going on at most of the, all three, with Nadine and certainly with Commissioner Jones and Zena and Commissioner Riggs.
Absolutely. Thanks, Tim.
Yes, I agree. I would say actually that a lot of the partners here, even though you may have placed yourself on a more food access side of things, because of the connections that you already have in place, like St. Ruth, like the Patch, like Memorial, like Community Enhancement Collaborations, Be the Drop Foundation, you're doing both, because even if it's not you directly doing the programming of the education with American Heart Association on board, you are then able to bring that information. So AHA, Lacey, if you're still there, I'm also going to put you there. So, All right, and just for the sake of time, I'm going to move us to our next steps on the meeting. But again, this is an ongoing conversation. We will probably revisit all of these in our first co-design meeting so that it'll give you some time. This was kind of like a primer, right? See what we're doing, see what to think about, so that then when we meet again, you can bring maybe just the notes or where you want to put it. Also, a reminder that if you fill out your partner ID or so your South Broward Community Health Hub database, you will see that there's going to be some questions that directly ask about your programming and the ways that you work in the community. So please make sure that you fill that out so we can continue to build our database. But for now, I'm going to move us back to our other screen, which is the presentation, so that we can wrap up for today. I want to be respectful of everybody's time, and I don't want to keep you all here for, I mean, personally, I would keep us all here all day so we can continue to talk about this, because I know that we all would like to talk about this more. But we were going to be scheduling some time for that purpose. And so if you just bear with me a couple more seconds, and I can get to, even though I'm supposedly a millennial based on some standards, I'm not the best technology millennial. So give me a second. There we go. Okay. We're back where we need to be. All right, so to help us establish this solid collaboration and the work that we've been talking about and how we can keep building from where we're starting, we also want to talk about our logo and the logo and branding for this effort. Again, this is a collective effort. This is a collaboration. We want to see everybody on this call represented, part of it, building with us together so that we can grow and expand your programming in a way that will help us all grow and expand, build each of our capacities so that we can all grow and expand, because truly it is a testament to how we've gotten here. Every single one of us has gotten here because we have been able to work together, because we've been able to link and connect to some partners, and those have helped us grow and connect to more, and those have helped us grow and connect to more. So if we can continue with that process that we've already been doing, that's really what we want to see. And having a logo or a thing that brands us and helps us tell this is what we're working together towards is really a goal of this vision too. Oh, what did I do? That was not what I wanted. Okay. So just kind of thinking of an elevator speech, and if you wanted to share more about this project with anybody else that you think or you saw was missing at our table, at our virtual table today, I encourage you to invite them to participate to our next meeting. I encourage you to connect them to me or anybody else that is on our team. Send me the information so we can have a meeting, we can share this. But if you want to share this with them, again, we'll share these slides with you so that you can have all of the things that I shared with you, and you can also use that to share with others. Again, we want to bring every single voice that we can to this table. And these are just some of the key elements to remember about our efforts, right? Engage and partner with local stakeholders, and local stakeholders include community members at the forefront, local business owners, nonprofit, and municipal leadership like we've had today from Hallandale Beach and potentially Miramar. We also want to co-create solutions for residents who are food and health insecure. Again, it's not just about the food. We're talking about food, but we have this bigger, bolder vision that will support people more holistically. And then we will, to that effort, we will coordinate, leverage, and grow our collective impact efforts through this collaboration. So if you can take 3 points about this meeting today and how we can move forward to building bigger connections and going wider with our net, these are the 3 key things. And if there's anything else that you would like me to add at this point, this is now, we can add it into this list. Maybe there's 4 points, or maybe there's an update. So anything else that you'd like to add that highlights our collaboration?
Really, a question about the overall objective. I know we're going to create a community action plan. How much do mayors and city officials have a role in buying into that community action plan?
Great question, Anthony. And I think we have to have them at the table too. I think the community action plan vision is collectively driven, but has a purpose of community drivedness, right? So it's going to be driven by community members and community partners, but we want municipal leaders to be part of the conversation, so that one of the things that we know very well in the nonprofit world and in our community and being citizens in South Florida is that we're not always heard of as community members by the municipal leaders. Or sometimes there's municipal leaders that want to hear and listen and be there, but then they have their different challenges in bringing up the important information and making sure that that is made policy or a program or support through the budgets from the municipal leaders. So we definitely want to have more municipal leaders at the table. It is going to be part of the goal that UHP will have in our outreach. We had a small cast net for municipal leaders for this one. We do have a couple. And I know that the two that are here are because they have been doing the great work of food access and community support already. But there are more that we want to bring to the table. So if you are connected to municipal leaders that you know are supportive of your efforts at your municipality, in your programs, in your organization, that's another person those are other people that you can bring to the table, talk to them about this effort, and see how they can connect with us. Because at the end of the day, the community action plan is to support the sustainability, the building, implementation, and sustainability of this collective effort. And if we don't have the policies and systems in place, both internally as well as in the municipal and county level, we may not be doing the work that we intend. So that is a very important piece. And thank you, Anthony, for bringing that up.
So I just a follow-up question, so I take a little time. Are we allowed to, is it education or lobby our community leaders, our decision makers? I don't know what the line is between lobbying and education with this project. So for example, if the faith-based network and mobile pantry want to speak to the mayor or commission, is there a barrier for lobbying versus education?
I will also, if we have somebody from the community foundation still here, maybe you can elaborate on this, but from my understanding, as individual organizations, as an individual community members, there is no issue to do that. I think we will see that as part of our community action plan. We'll have some efforts. Actually, a partner that didn't make it today, Florida Rising, they're community grassroots advocacy organization. So if there is a grassroots effort to build advocacy around the things that we're doing, I don't think there's a lot of, I think the biggest constraint would be UHP if our grantor can't. But I can have that conversation with our grantor and figure out those delineations for sure.
Rally?
Yes.
Yeah, I think Anthony brings up a very important piece, and certainly we want to involve them. And maybe at some point in time when we do have another collaborative meeting, everyone can invite their particular municipal leaders and so forth to a Zoom.
I like the idea.
Or whoever they decide that would be their designee to come and at least hear what is being said and what we're trying to accomplish here.
Agreed. So we'll definitely keep that. And I think Sherry from the Community Foundation, Sherry Brown, shared that, yes, engage your local elected officials. So let's do it.
Yeah, Community Foundation have no issue with you engaging with and educating any of our elected officials. It's just good community outreach.
Wonderful. So let's do that. And now finally, here we are, some logo ideas. These are not set in stone. I really would like to just hear feedback of these two, which one you like more. Is it the one on the left or is it the one on the right? And what do you like or dislike about it? Please feel free to use the chat to provide your feedback so we can kind of keep moving forward. Because I want to respect everybody's time and I don't want to keep you here any longer. I know everybody's busy and I respect and love every single thing that you all do. And for that reason, I don't want to keep you here any longer. So please put on the chat of these two first examples, what do you like most of each one or what you don't like of each one? I'm going to leave it up for a minute and then I'm moving. We have 3 slides with similar examples. So just tell me slide 1, left or right, and what you like about them.
Left.
Colors.
I like the colors.
Yeah, agreed. For me too. Alrighty. And I think we have some of our community liaisons on the call. If you can take notes, if you can see on our notes, please. All right, I'm going to move on to the next. Again, slide 2. This is slide 2 for logos. And you can tell us left or right, what you like, what you don't like, what you would like to add. Maybe there's something missing. I don't want to bias you, but please tell us. Is it the font? Is it the colors? Is it the image? Would you add something to it? Would you take something away? What preference? Maybe the left, maybe the right. Go ahead. Sorry, I think Bishop Scott, I didn't hear that. What'd you say?
Left.
Left.
Yeah.
And maybe we can add a little color to that as well.
Yep. I kind of like the color, like the right colors on the like more reddish or whatever, and the crepe.
Right.
I also feel like there's some health components missing from this one, right? So maybe maybe our health partners can share some ideas of how we could add a little bit more than just Health Hub, because Health Hub is highlighted a little bit different to bring that health component, but maybe it's the T is made more of an X, kind of like I don't know. Just give us ideas. That's what we're here for.
Chat, close that.
All right, and I'm going to move on to the final 2. And you can put here slide 3 and what you like, what you don't like, left or right.
I like right because I don't think we should be boxed in.
Yeah, oh, I like
Oh,
that.
good
Miss
point.
Black, I like that.
I
You're so
agree.
right. We should not be boxed in. I
I'm
really
sorry.
like that. No, that's a great point.
Also some color to that number on the right.
Correct. Maybe the apple can be like with that red from before or something like that.
Yeah, the color's not really eye-popping that much.
Agreed. Great feedback, everybody. Yay. And then after all of these are done, if you had one pair that just stood out the most, say slide 1 for the ones that had the circle, slide 2 for the ones that had the food boxes, and slide 3 for this one that has like the heart apple holding thing. And one of my comments for this one that I want to record too is I would love to see more hands because it would speak to our collective. So instead of just one hand, maybe there's multiple hands.
Yeah. Okay, good idea.
All right. Thank you all. And if you have additional feedback, you have my information, you have my phone number, call me, text me, email me. I sometimes don't sleep, so just holler. All right, and now we're on to the end. We will be sending you this kickoff meeting partner survey to just kind of get a little bit more feedback about what you're doing already, kind of help us establish a baseline of where we started so that we can see where we grow. So we'll be sending you a follow-up email with the slides, with the recording, and with the surveys, both the partner ID survey, which is the database, and then the second one, which would be the kickoff meeting partner survey that will establish a baseline for us. And we want to schedule at least our first meeting in March. Would the last Thursday of March around this time work for everybody?
It's good for us here at St. Ruth.
Okay. Any other partners that would like to voice yes, no, that does not work. Let's try a different time.
Works.
Okay, so just for the people, I said the last Thursday in March, and I didn't even say the actual date. So let me look for that. The last Thursday in March will be, March 25th. Actually, it fits, it's the same day, March 25th. And we would be thinking around the same time from, we could probably, this one would be probably about an hour and a half instead of 2, but still maybe 11 to 12:30. Okay, if you share thumbs up, please share thumbs up if that works for you. If you want to say and voice it and verbally, please do that as well. Otherwise, we will be sending the email, and we can also send out a doodle, but I'm seeing a lot of thumbs up, so that's great. And for those of you that maybe don't have the thumbs up yet or cannot let us know, we'll make sure to share the email information with you. And then for the last thing, if there's any things coming up this next week or something that a partner would like to share right away, a community member, anything that you know that you would like to share, I just want to give that last shout out opportunity.
Aurelie, on Tuesday, we're supposed to be doing a food distribution. The young man was supposed to have been coming by the church in an hour, so he should be here. We will give you a time.
And I just gotta say that one was such a cool activation of the network. It was something that just happened during a meeting, connecting, and now we have food that's coming to Dania Beach through St. Ruth's efforts and the Hunger Coalition's efforts to really serve the community. So anything that comes our way, anything that you say, you know what, let's connect it to the hub. Let's connect it to the hub. Email me, call me. That's what we're here for. And anything that I can do to support each and every one of your works, personally and as our organization is funded to coordinate this effort, we're there. I'm there.
Okay, and thank you so very much.
Thank you all so much. If there's anybody else that would like to share something else, please do. Otherwise, I'm going to leave this open for people to leave if you need to go, but I'm going to stay for a couple more minutes in case there's other questions. So thank you so much. This adjourns our meeting. We will be seeing each other next month, and please expect our follow-up email with some of the cool information that we came up with together today. And